Hey everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Melissa and I'm a registered nurse. So in today's video, I'm going to be talking about different job opportunities and potential career paths that can be available to nurses once they obtain their master's degree in nursing, or their MSN for short. So first I'm going to go over exactly what an MSN is, and then I will get into the different career opportunities as well as the salary outlooks for those jobs. So a master's degree in nursing, or an MSN for short, is a post-licensure graduate level degree that is available to nurses in order to help them advance in their careers by helping them specialize in certain areas of nursing care. On average, it takes 2 years to complete a master's degree in nursing if you are going to school full-time. And even going to school full-time, because a lot of programs are available online, it is very possible to maintain a full-time job while going for your MSN degree. Although if you do want to go part-time, it can take up to 4 years on average. And nowadays, there are a lot more accelerated nursing programs popping up that can allow you to finish an MSN degree in as little as 12 to 14 months. So now I'm going to get into different career opportunities and jobs. And as I'm talking about each job, I'm going to go ahead and put the national average salary right here next to me. I do want to put a massive disclaimer that I got all of these from salary.com, which I believe inputs information from what people enter into it. These are just average salaries. So there are places in the United States where the salary is going to be significantly less, and there are places in the US where the salary is going to be significantly more. So it all depends on location, it depends on the size of the organization that you work for. So this is just a national average and an estimate of like the median of what people are making in these careers. So first I'm going to talk about nurse midwives or certified nurse midwives. The average salary in my area, which is like the DC metropolitan area, is about $138,000 a year. With this job, you will be helping women with prenatal care before they have their babies, with medical check-ins, you'll be helping to deliver babies, and you will be helping with postpartum care. So the next one is another one of my personal favorites, and this is nursing education. It is a big umbrella that includes clinical educators, so staff that goes into the hospitals and they will teach the nursing students how to do the hands-on skills, as well as nurse educators that are in the traditional lecture halls where they're standing in front of a classroom of students and they are giving lectures. So in this career, you would be helping to mentor students, mentoring the future nurses of tomorrow. You would be creating lesson plans in the classroom. You would be administering exams. You would be doing one-on-one tutoring, helping students, and really just prepping the workforce for nurses, which is very much needed. So the average salary for that is right next to me. Now, another profession that makes a significant amount of money, in my opinion, would be a nurse anesthetist. This is another career where you would need that higher degree. In my area, the average salary of a nurse anesthetist is about $221,000. So it is six figures, and it makes a substantial amount of money. In this career path, you would be helping surgeons and helping patients in surgery by giving them anesthesia and medication to make sure that they are sedated, and then helping them safely come out of sedation once surgery is over. Now, the next career path would be in nursing informatics. So there are different job titles when I did my research online that fall under this category. So some of the different titles I saw, I have my computer next to me. Clinical informatics specialist is a very popular one. There's care management informatics specialist. You do need to be an RN with a higher degree for that. Provider informatist. So there are different job titles, but overall it's kind of this umbrella under nursing informatics. And my best understanding of this career path would be where nursing and the clinical side of healthcare and technology kind of collide. So especially in this world where a lot of things are becoming more and more AI, Throughout the nation, most electronic medical records are digitized, and we're using like Cerner and Epic, and we're using technology. There's also a rise in telehealth. So this is definitely a specialty that is on the up and up. The job outlook for this is amazing, and I put the national average salary right here. You can make really good money with this, and it is so broad, in my opinion, that this is a great career path to go into. Another job or career path would be the career of a nurse researcher. I used to work at NIH for some time, which is the National Institutes of Health. So especially in my area, we have NIH, we have Walter Reed. There are a bunch of different teaching hospitals. So a nurse researcher is a job where, in my opinion, you will always be able to find a job. And this is one where you're doing good work. Typically it involves a nurse working on different clinical research projects, oftentimes in pharmaceuticals or within the realm of epidemiology. And so you're helping a lot of people, you're doing a lot of good work. If you don't really like the bedside experience or direct patient care, this and nursing informatics are two great fields to go into. I put the average salary right next to me. I think that this is a great career option, especially for those that are kind of older and want a more traditional 8-hour schedule. So like 5 days a week, 8 hours, like that typical 9 to 5. I think this is a great option. And then lastly, we have the very large umbrella of nurse practitioners. I'm gonna make a separate video talking all about nurse practitioners just because there's so many different types and salaries can vary, but on average, this is the average salary throughout the nation. There are neonatal nurse practitioners. There are, I believe, family nurse practitioners. There are women's health nurse practitioners. There's adult and geriatrics. There's psych. There's so many different types. So I'm going to go ahead and make a separate video. But if you are somebody that does like the clinical aspect, you do like direct patient care, nurse practitioner route, in my opinion, is a great route to go in because you are still seeing patients and you are still in that clinical environment. You still get to be a clinician. So these are just a few of the very many career opportunities that can be available if you are interested in getting your master's degree in nursing. If you have any other career opportunities that I did not list and you would actually want to go into, please go ahead and comment them down below. If you have any questions, you can comment down below. Thank you guys so much for watching. Please like this video and subscribe to my channel, and I will see you in my next video.